Dr. Frisch. He's a chiropractor here at Brookdale Health. So, Dr. Frisch, what is a question that you get asked all the time and you're just like deep down, like, but then you have to answer the question?
When will the pain go away?
Mm.
That is probably the biggest one, because a lot of the times that's why patients are presenting. They're in pain. They want to resolve the pain. They want to get back being in their normal lifestyle without the pain and be able to function, spend time with family, you name it. When it comes to pain, pain's a tricky one, because a lot of the times, anytime an acute injury happens, you suffer swelling, inflammation, tissues repairing. That's painful.
Mm-hmm.
But what happens is the body's neurology, if you don't correct those dysfunctions and abnormal movements and help the tissues heal properly, people develop chronic pain.
Mm-hmm.
And chronic pain, we're finding, is a lot of more chemical and rewiring that needs to happen in the brain. So when people say, when can I get out of pain? It's a loaded question, because if they're not,
Mm-hmm.
a neuroscientist, I can't break down the specifics.
Right.
So they just have to trust what I'm saying. And a lot of the times that can be challenging and scary.
For sure. As a chiropractor, I can only imagine that dealing with patients who have been in a car accident, they're obviously in pain when they come in. How do you get past the part of increasing their pain just to get them better? Is that something that you have to deal with?
So a lot of the times when we restore motion and get them back, trying to get them to be more active, because that ultimately will help their tissues heal efficiently in a controlled manner. But a lot of times people are fearful of that pain, and I have to try to explain to them the pain isn't the problem. The pain is more of an alarm system, kind of like a home security system.
Mm-hmm.
Prior to a crash, to set off that system, you would have had to break a door down, break a window in your house, and set off the alarm. After the crash, the body's more sensitive, it's more on alert, it's more protective of the body. So a leaf hits the door of that house now, and it sets the alarm off.
Mm-hmm.
So things are just more sensitive, so I have to tell people, hey, that type of movement, do you think that's enough to cause actually trauma to the tissue? Well, no, but it hurts. Well, yeah, because your body's overprotective.
Mm-hmm.
So it's getting them to understand where their body's at and where we're projected to try to heal it. And in order to do that, you do kind of have to push a little bit into the pain, but respect it.
For sure. As a chiropractor as well, since you've been in this field, is there any experiences that kind of stand out to you?
I mean, I would say the biggest one is never judge a book by its cover.
Mm-hmm.
I mean, you'll get patients in here that you're like, this person should heal in a couple weeks, and athletic build, they're active, and that patient takes a couple months.
Wow.
Then you get a patient in here, you're like, oh, this one's going to take a while.
Yeah.
That patient heals really fast. It all depends. So that's why we at Brookdale Health, we start you on a treatment plan. We recommend, hey, let's go this many times a week or for this many weeks, and then we'll reassess. And those reevaluations are important because it gives us an idea of where their progress is at, and then we dictate care based on that.
And final question, is there an experience or a success story that you had happen where the patient is like bringing you cookies or baking you a cake, like, I'm better, I'm so excited?
I mean, we at Brookdale Health, we get patients all the time that come in that bring food and they say thank you, thank you, thank you.
Mm-hmm.
And it happens, all the time actually. So it's, we view that as we're doing the right thing for our patients. We're focused on the right things. Now, ultimately, with those cases, we do have some of those patients that aren't happy with their care, and you got two sides to every coin.
Right.
So the goal here is obviously to help patients better their lives and improve their injuries and complaints in the best way we know how. If we're not the right place, we'll make sure you get there too.
Absolutely. Well, thank you, Dr. Frisch, for your time. We appreciate it. I know you have to get back.
I have to go get back to seeing patients, but it's always a pleasure to spend time with you guys.
All right, thank you. Back to you, Q Bear. In the studio, I'm Chantel Sings live at Brookdale Health. Go to brookdalehealth.com for more information.